everyone. I wanted to go through these cases with you. They're on the website. I'm actually going to take down the PowerPoint that's there and just have this one on because I made some changes to it. I just wanted to talk through these with you. I'm going to do this in lieu of a quiz. So please make sure you do take the time to go through this so you get a good idea about triage. And if you have any questions, please let me know. So this is a series of cases. Imagine you're the triage nurse at your hospital that you walk out into the exam area or the reception area to meet, and then you need to decide how, whether you're going to give them 0, 1, 2, 3, 0 being non-urgent, 1 being urgent, 2 emergent, and 3 life-threatening. So here's the first scenario. Your patient is a 4-year-old domestic long-haired cat, neutered male. The history is not eating for 2 days, acting lethargic, and owner is unsure about normal urination. You just see very quiet. This video corresponds okay, but some of the videos are kind of just not acting particularly cool. Temperature is 98.7. Heart rate is 100 beats per minute. Resp rate is 18 resps per minute. Mucous membranes are pale and the CRT is 2 seconds. So take a moment, think about those values, whether they're normal, abnormal, and where you would rate this cat from 0 to 4, okay? And again, the videos can be a tiny bit misleading. Really just pay attention to the history and the vitals. Patient 2 is a 5-year-old Maltese, female, unspayed, history, straining to defecate. Our little puppy dog. You can see he looks pretty bright, tail wagging, etc. Temperature 102.6, heart rate 115 beats per minute, resp rate 35 resps per minute. Okay, and rate that one. Patient 3 is a 1-year-old pit mix, female spayed. History, vomiting for 2 days, can't keep any food down, is drinking water okay. Dog is still pretty bright, maybe not quite playing with a ball. This is just a really cute video of a pit anyway. Temperature 101.2, heart rate 100 beats per minute, and is panting. Everything else seems pretty normal. So take a moment, think about where this puts you, write it down. Patient 4, 4-year-old mixed breed dog, female spayed. The dog was in a dog fight and the patient is bleeding profusely. That's the dog, but said this video is a little bit temperature is 102.2, heart rate's 130, panting, and there is blood everywhere. So imagine blood everywhere after the dog fight. Okay, what levels did you assign these patients? So hopefully you thought about it, wrote it down. The first one we put down is life-threatening. Keep in mind how low those values were. The temperature was low, the heart rate was low, everything was very low, the animal was pale. So that animal is very concerning. Don't forget, when things get on the low spectrum and the animal is sick, that is a very big problem. Patient 2, the dog straining to defecate, that's probably non-urgent. Patient 3, even though the pit video looked pretty bright, the fact that it had been vomiting and not able to keep food down, urgent. And patient 4, blood everywhere, it would be life-threatening. Scenario 2. Patient 1, 5-year-old domestic short hair, female spayed, sneezing, runny nose. It's a little kitty. Temperature is 102.4, heart rate 168, resp rate 25. So everything seems pretty normal with kitty except for a sneezing, runny nose. Patient 2 is a 5-year-old coonhound mix, female, unspayed, history, occasionally vomiting, peeing a lot, and ADR, or just ain't doing right. So, not a lot of info, but just something's not right. Definitely vomiting and peeing. There's that little dog. Temperature is 103.2, heart rate's 125, respirate 30 reps per minute, and mucous membranes are slightly pale. CRT is less than 2 seconds. Patient 3, 7-year-old lab, neutered male, history inappetent, so not eating, vomiting up phone, uncomfortable, QDR, so quiet, depressed, but responsive. Dog's kind of licking. Definitely not looking happy. Nauseous. Temperature is 100.3. Heart rate is 165. Respirate, the dog is panting. Mucous membranes are pale, and CRT is 2 seconds. Then patient 4 is a 7-year-old domestic long hair, female, spayed, vomiting occasionally, usually food after eating, eats well otherwise. And this is how our patient behaves. Yeah, we all love those. Temperature, not quite sure. Heart rate, not quite sure. Respirate, not quite sure. So where do you put this cat in the patient lineup? Okay, so first was non-urgent. Now I have to remember what it was. 2, emergent. So that was so non-urgent, what was that? Oh, that was the sneezy kitty. Sorry, mild respiratory issue. So not particularly urgent, should be seen, but you're not overly concerned. Patient 2 was the ADR coon mix, peeing a lot, maybe some vomiting. So it could be serious. You definitely want to get that animal in and seen quickly, though not necessarily as serious as patient 3. The vomiting, the discomfort, you're really worrying about an intestinal blockage or DDV with this dog. And then patient 4 could be non-urgent or urgent. It's a little bit hard to tell, but definitely based on the animal's behavior and clinical signs, doesn't seem like it needs to push out at least patient 2 or 3. And then here's one more round of scenarios. A 4-year-old mixed breed dog, male neutered, history limping on the front leg, and today is not eating. Nope, doesn't really want the treat. Temp is 101.8, heart rate 99, respirate 20, mucous membranes are pink, and CRT is less than 2 seconds. Next patient is an 8-year-old boxer, male neutered, history breathing funny, occasionally vomiting bile, and abdominal distension. Really not a comfortable animal. Temp is normal at 100.5, heart rate is 135, respirate, kind of weird looking, panting, mucous membranes are pale, and CRT is 2 seconds. Patient 3 is your domestic short hair, older cat, 15, male, neutered, has lost 5 pounds in a week, eating everything and occasionally vomiting. Whew. Cat looks kind of dehydrated. Temp is 101.3, heart rate 200, respirate 25, mucous membranes are pale pink, CRT is less than 2 seconds. But that cat's pretty crappy and dehydrated looking. Patient 4 is a 9-year-old cavy, female spayed. The dog is ADR, she fell off the bed, yelps when picked up, and weakened the hind end. Temp is 102.3, heart rate 89, respirate 15, mucous membranes are pink, and CRT is 2 seconds. So how did you rank these? Patient 1 was non-urgent. Now again, I have to go back and remember. Why am I blanking? Patient 2, life-threatening. 3, urgent. 4, emergent. Okay. Patient 3, I think, sorry guys. Patient 3, I actually might move up into the emergent category because of the dehydration. And patient 2 is that boxer, yes. Sorry, this is a little confusing. I'm going crazy. Patient 1 was our limping dog. Yes, lameness is considered a non-urgent. So, if you're not getting all I's crossed of me blinking through these cases real quick, this dog was definitely emergent to life-threatening. And this one I would probably actually bump up to urgent, maybe even life-threatening, depending on the dehydration. Again, that just shows how subjective things are, but that cat probably shouldn't wait for too long. And patient 4, I put in as emergent because that's what we discussed with back dogs. You want to get them stabilized and ready for surgery because time is of the essence. You may be able to save movement or prevent further disc problem if that is indeed the problem, which is a good suspicion. So I hope that made sense. Again, if you weren't quite, if you picked emergent and it's urgent, that's not the end of the world, but, go through, try to keep these along with the guidelines I gave in the triage video, and hopefully that made sense.